Welcome to video number 3 on growth and development. We left off talking about intimacy versus isolation in adults, and that is pretty much where we're gonna. There's more in Erickson's development, but we're going to move along and uh, discuss those. I'm sure they've been discussed in your med surg classes, but it goes on to industry versus stagnation and then on through aging. So, but we're going to stop with intimacy versus isolation because a pediatric patient is usually seen until around age 21, depending on the practice, because most pediatricians will see their patients until they're out of college. So when is development atypical and what are we going to do about it? The first thing we're going to do when we see anything that's atypical, maybe they're not grasping. I know I had a patient, I work in, when I'm at Ephrata, I'm normally a supervisor, but I also work in their FMU unit, and I was taking care of a newborn baby that they're suspecting has dwarfism, and that baby did not have a grasp. Bilaterally. So that's a developmental delay that's from the beginning. And that baby's discharge plan had, they're already sending them to a physical therapist and all kinds of stuff so that that child has the ability to grow up and function as normally as possible. So the earlier the intervention, the better. And then they have special education services that start at age 3, but they have early intervention services that start at birth. Again, there's some NCLEX questions on your PowerPoints. We're going to go over those in class. But feel free to peruse them on your PowerPoints and find the answers for them. So what are we going to do to promote health? I think that that is one of the biggest jobs we have as nurses, is to promote health for children, families, and appropriate growth and development through the lifespan. So the very first thing we can do is provide appropriate nutrition. Diet for a newborn is bottle or breast milk only. They're starting by 4 months to have what they call an extrusion reflex, which means you stick something in their mouth, their tongue's going to move forward to spit it out. And that's how they learn how to, by spitting it out, by the way, that's how they learn how to bring food in, and they're able to eventually take food. By 4 to 6 months, they're starting to move things around in their mouth. So that's pre-chewing movements. Their suck becomes very strong. When they see a nipple coming towards them, they're going to open their mouth and prepare for it. You don't have to coax them to eat by any stretch of the imagination. And usually by 4 to 6 months, they're starting on some sort of solid food. By 6 to 12 months, they can chew pretty well. So you can cut up little bites of just about everything you're eating and they can eat. They're starting to get teeth. If the mom's breastfeeding, they might bite. So the mom has to teach the baby not to bite. They can begin with a cup, and a cup can start as early as 6 months. By 9 months, again, they're eating Cheerios using that pincher grasp. So they're eating Cheerios. They can start to eat little pieces of fruit, that kind of thing. By 12 months, they're eating finger foods. They love to eat independently, so you can start to chop up things like chicken and different vegetables into small bites that they can eat with their fingers. Iron stores that the infant gets from mom prenatally will be depleted by age 6 months. So there's a couple of things they do when they start them on on cereal, it's iron fortified. Formulas are iron fortified. Sometimes if a baby is not getting appropriate iron on a breastfed mom, they will start them on an iron supplement. By 7 to 8 months, they're eating vegetables, again, finger fruits, table foods. They're pretty much eating what mom and dad eat, and they like to eat what mom and dad eat. Toddlers, they use a lot of calories, 13 to 1400 calories a day. That's more than most of us overweight adults need to eat. They are burning calories like crazy. They're very, very busy. And so it's kind of shocking sometimes how much a toddler will eat and needs to eat. Portions for children need to be very small. So if you're feeding them, let's say macaroni and cheese, you want to give them 1 tablespoon for every year of life. So if they're 3 years old, they get 3 tablespoons. Remember, you can't give them an adult-sized plate of food and tell them they have to finish it. That's not fair. They shouldn't finish it. That actually leads to obesity, and we certainly have enough trouble with that in this country. They like finger foods the best because they can feed themselves. They like to drink from a cup. By 15 to 18 months, they're starting to hold a spoon. By 2, they're pretty much completely feeding themselves, and they love rituals. And what that means is they like to eat the same food in the same cup, in the same chair, with mom sitting on the same side, dad sitting on the other side. Family dinners have a purpose in development, and children thrive at mealtime when things are the same. Preschoolers, they're not growing as fast as infants and toddlers, but they still need lots of calories, about 1,700 a day. These children become very picky eaters. This is where you have to determine whether it's an actual preference or whether it's defiance. And only the parents can answer that question. But what is important as a nurse is anticipatory guidance about picky eating and then providing nutritious snacks. Every preschooler I know would be happy living on Ho-Hos and Twinkies. But guess what? Their teeth aren't going to grow, and their liver's not going to grow, and nothing's going to grow. So we got to really work with the parents to discourage high sugar snacks and encourage fruits, vegetables, lean proteins, that kind of thing. We need to respect their independence, however, and never force food on a child, but we still have to encourage eating and encourage the appropriate part. Again, rituals are important. Favorite plates, favorite cups, all that kind of stuff. And mealtime should not last more than 20 minutes for a preschooler. If you're going to go to a fancy restaurant and expect them to sit there for 3 hours, you're probably going to end your evening in disaster. School-aged children, they eat very well, and they eat different foods. They need about 1,600 calories, 1,000 calories plus 100 for each year of life. So if they are 10, they're going to need, what would that be? 1,000 plus another 2,000. So think about it that way when you're planning meals and teaching about how many calories a child should have. Mealtime should be fun. This should be part of their day where they talk about what they did at school, what's going on with their friends. You can learn all kinds of good things at a family dinner if you just let children talk and interact with each other. Adolescents, especially if they're playing sports, look at how many calories they need. Tons. All adolescents want to do is eat and sleep. I remember when my children were little, one of I have 2 boys and then an age span and 2 girls, and when my boys were little, I remember a friend saying, "You just wait till they're teenagers. They're not going to ask for a turkey sandwich. They're going to go to the fridge and eat the whole turkey." And it's true. Both of my kids played soccer, and they were thin at the time, very, very muscular, and ate they could eat nonstop and not gain weight. Then they graduated from high school. They weren't playing sports as much. They both put on quite a bit of weight, and now they're in their early 20s and have taken it off again, and becoming more active, not wanting to um, develop bad habits. So again, here's some more nutritional NCLEX questions that we're going to go over in class, but feel free to work on them in the meantime. Next subject is the language of children. Birth to 4 weeks, they just cry. And they start to make a little bit of cooing and noises. 6 weeks, they're starting to smile at mom and dad, people that they know, voices that they know. By 2 months, if you know the child, you can differentiate the cry for hunger, for boredom, for pain. They'll all be different. Sorry, I went up ahead on the slides. By 3 to 4 months, they're babbling and cooing. This is a really fun stage. By about 4 months, they can laugh out loud. By 24 weeks, so that's about 6 months, they start making bubbling sounds with their mouth. They're starting to, like, that's their tricks. By 28 weeks, 7 months, they can start saying mama, dada, maybe, those kind of sounds. Not sure that they're real words yet, but by the time they're 10 months old, when they say mama or dada, it's usually with meaning. They know who they're calling for. Again, by the time they're 2, they have a pretty good vocabulary, about 300 words. They're starting to put together very simple sentences. By 6, they have a vocabulary of about 2,500 words. And now, thanks to really cool television programming and education, I think that this number is probably higher than that. There are some kids with some really significant, well-rounded vocabularies. So what are we going to do to promote this healthy child? First of all, we want to keep them safe. Number 1, they're not leaving the hospital unless they've been tested in an appropriate car seat and their parents have learned how to use it. Even in the Amish community, where they don't always require car seats, when a child leaves the hospital, they must have a car seat. And we have a car seat, someone who's certified in car seat work, and they deal with the parents to make sure the car seat's in the car properly, that they have put the child in properly. Again, anticipatory guidance, all about car seats. What size, which way it faces, how long you should keep it, all of that kind of stuff is very important. The other big program push is back to sleep, and what that means is you lay the child on their back to go to sleep. No laying them on their belly anymore. That has to do with research regarding SIDS. So children sleep on their back. Water temperature is very, very important. Children can be scalded by just turning the water faucet on. So you want to keep the water heater at a low enough temperature that it kills the bacteria in the water, but will not scald the child as quickly. So that usually is between 120 and 125 degrees. Smoke detectors in homes, another thing to talk to parents about. Small toys. This becomes an issue if you have, say, 2 children, one's 9 and one's 9 months. The 9-year-old might have little tiny Legos, and the 9-month-old wants to put everything in their mouth. So you have to really come up with some solutions. You know, if the 9-year-old wants to play Legos, it has to be in their room or at the table, and you know, none of that small stuff on the floor. Those are pretty easy things to negotiate with children, but they do have to be negotiated before they swallow something. And then the final one is the use of sunscreen, which is extremely important in this day and age. We want to prevent injury, so of course car seats are going to do that. We have to teach the parents that the child's curiosity is going to exceed their judgment. And this goes all the way through adolescence. Kids will do some crazy things, but little ones like to stick their fingers in anything else they can in electrical outlets. Pot handles need to be turned towards the back of the stove. If there's animals, they need to be very careful if the animal does not belong to the parent. We have a dog who's very old, and he can't be around my grandchildren